Welcome to the Millcreek Government Channel. I'm Judy Zelina, and March is Diabetes Awareness Month. Even though we're aware of diabetes every month, March is our designated awareness month. And here today on the program to talk about diabetes and the importance of exercise, we have Nicole Wolf. Nicole is the Executive Director of the Erie County Diabetes Association. And joining us, we have Chris Sutton. And now Chris is a fitness specialist for LeCom Medical Fitness and Wellness Center. Thank you both for joining us on the program. Both subjects so important.
Yes.
And really it's a very important mix, exercise and diabetes. First off, Nicole,
yes.
I had mentioned that March is designated Diabetes Awareness Month.
That's right, yes.
So really, what does this mean to our viewers?
Well, during the month of March, the Erie County Diabetes Association tries to really get out into the community to raise awareness about what type 2 diabetes is and really encourage people to learn what their risk for the disease is.
Okay, what are the risks for diabetes?
Well, for type 1 diabetes, type 1 diabetes is a non-preventable form of diabeties.
And that's what we used to call, was always referred to as juvenile diabetes.
That's correct.
Correct?
That's
type 1.
That's correct. And so there really aren't any risk factors for that because there's no prevention for it.
Okay.
Now, type 2 diabetes is a whole different ballgame. Type 2 diabetes has risk factors such as if a person is overweight, has high blood pressure, has high cholesterol, leads a relatively inactive lifestyle, has gestational diabetes, has had gestational diabetes, gave birth to a baby that was over 9 pounds. Those are all risk factors for developing type 2 diabetes.
And you don't need to have all of those risk factors to be maybe heading towards diabetes. Any of those can be a risk factor, correct?
That is correct. We encourage, though, during the month of March, for people to really investigate their risk by taking what we call a risk assessment. And we have that posted right on our website at diabeteserie.org.
Okay.
And it's a quick 2-minute little question assessment that will help the person to identify whether they are in fact at higher risk for developing type 2 diabetes.
Okay. Now, what about signs, symptoms of diabetes?
Well, with type 2 diabetes, this is tricky because it develops over a long period of time. So a person may, in fact, not have any signs or symptoms. But folks should watch for some of the most common symptoms, which would include an unquenchable thirst, frequent urination, and hunger. Some of the other symptoms are blurred vision, dry or itchy skin, wounds that are slow to heal, or frequent infections. Those are some of the others. Okay,
now Chris, I know you're a fitness specialist, and you're here with us today talking about diabetes. Now, how did this happen that you ended up getting interested in this field with your fitness?
I've always been interested in diabetes. I know it's an issue that just seems to be constantly on the rise.
Right.
And just being in the fitness industry, weight management is so important to this kind of population that I really wanted to work with them and kind of show them that there is, it's not a life sentence, especially with type 2. Yeah. You can make changes in your body weight and your health with a combination of healthy diet and drug therapy that you can actually somewhat reverse the process itself.
I think that's interesting because, I have met people who are fitness specialists, and that's exactly what they do. But you sort of had a little niche you wanted to get in there.
I knew right away. Big inspiration was my aunt. She actually was type 2 for a long time. She made an incredible change in her lifestyle, has lost an incredible amount of weight, and is either teetering on the edge of not being diabetic anymore, but just the improvement she's made in her life has just been...
So you really have seen a difference.
Oh, incredible difference, yeah.
So, now, back to the risk of diabetes. Now, what should a person do if they discover that they are at risk for developing diabetes?
That's a good question. So if a person takes that risk assessment and it finds that they are at higher risk,
yes.
The first step would be to contact your primary care doctor to discuss those risk factors. And then the doctor and the patient can determine whether further testing is required. And in most cases, the doctor is going to recommend further testing. 3 of the blood tests that are used to diagnose diabetes are a fasting blood sugar test, and so that's typically an 8-hour fast, 8 to 12-hour fast before the blood test. The doctor may also order what is called an oral glucose tolerance test, where they'll have you eat a high carbohydrate meal and then test your blood sugar 2 hours after the meal. And then the third test would be the hemoglobin A1C, which gives the person an indication of what their average blood sugar level has been over the last 2 to 3 months.
Okay. Now, once you are diagnosed with diabetes, now, Chris, how important is exercise to a diabetic?
Exercise is important for everyone, and no matter what population, what disease, but it's crucial for diabetics, especially type 2. Weight management is really the main focus for lifestyle modification, besides diet and the drug therapy and medication that you're on. But the benefits you can receive from exercise combined with the diet is going to be improved insulin, how your body uses insulin resistance, and the sensitivity. It's going to help, obviously, losing the weight, and losing the weight is going to really take a lot of load off the body in itself, and it's going to improve how your body uses its glucose.
Okay, because one of the risk factors were, of course, being overweight.
Right.
Now, even if you are not diagnosed with prediabetes, which we're going to talk about in a minute, exercise can help you prevent becoming diabetic, correct?
Also, cardiovascular disease, just to name one, you can name it.
And that's all linked too.
Absolutely.
Correct?
Yep.
Right. Yeah, most people, in fact, 2/3 of the people with diabetes have some form of heart disease, whether it's high blood pressure or...
See, you taught me that. I did not know that.
Yes. Yep. So people with diabetes need to be concerned not only with their blood sugar, but with the other things that are linked with heart disease, like blood pressure, cholesterol levels.
Okay. Now, prediabetes, we were talking about. What are, now the risks of prediabetes are pretty much the risks of diabetes,
That's
am I
right.
correct?
That's right. Prediabetes is really the precursor to diabetes.
Will I
to
definitely
type
get diabetes?
Not necessarily. Not necessarily. Especially if you learn that you have prediabetes and you make those lifestyle changes that what Chris was referring to with the diet and the exercise. And in fact, I'm going to reference a clinical study that was conducted a couple years ago. It was called the Diabetes Prevention Program, and they took a mass of individuals, 3,500 individuals that were at risk, high risk for diabetes. They had prediabetes and other risk factors that we spoke of. And they put them through an intensive lifestyle management program. So, counseling on diet and encouraging 150 minutes of exercise per week. And those that adhered to those lifestyle changes actually prevented diabetes by 58% versus those that were on drug therapy, which had a return at 31%.
Oh my gosh.
So it proved essentially that lifestyle changes are actually more effective than drug therapy in preventing diabetes.
And it's so hard for lifestyle changes.
Absolutely.
Because I think the biggest thing with diabetes is when someone's diagnosed with it, or even pre-diabetes, right away it's overwhelming to them. Oh my gosh, I got to lose weight. I have to change my whole diet. This is just too overwhelming. It just seems too much for them. So they do nothing.
Especially because it's typically not caught right in the beginning. It goes undiagnosed for quite some time until either something happens or you go into the doctor and you have any type of glucose test, and then it's usually really bad, and then you're kind of really in a panic mode. But if caught early, you can make those changes slightly and make it an easier path for yourself. That's
because gradual changes, it's so much easier to do it gradually.
Right.
Yep. So checkups are important.
Okay. And what you were referring to, Judy, is what I call analysis paralysis. So we're looking at all of these things that we want to change, and it becomes so overwhelming that we become paralyzed.
Right.
So the best approach to making any lifestyle changes is to start slowly, pick one thing that you know that you can be successful on, because success begets success.
Okay. Now, exercise, Chris, how does it affect your blood sugar levels?
Blood sugar levels see a big impact from exercise, especially diabetics. You really need to focus on that. That's why keeping a log is going to be the most important thing for an individual with diabetes.
Okay.
The kind of effects you're going to see, blood sugar is going to drop during exercise. Your body uses glucose as fuel to fuel your muscles. So with the lowering of your blood glucose levels during your exercise, you have a big chance to get hypoglycemia, which is going to be a low blood sugar, and it's going to cause nausea, dizziness. When you get up, you kind of feel faint, pale, clammy. Those are signs that individuals should be aware of and look out for, and always should carry a carbohydrate snack on them. Usually whenever they go, just kind of, if they are feeling hypoglycemic, that they can ingest that and hopefully bring their blood sugars back up.
So, okay, so when they're working out, first off, hydrate. They're going to need a lot of water.
Always.
But like you said, always have a snack because you may need it afterwards. Will you for sure need something afterwards, or just depending on probably where your levels were before you started exercising, maybe?
It's always a great idea to bring it with you just in case. But the individual's not going to know until they actually go through the exercise. It's going to be trial and error. That's why keeping it like a diabetes notebook, which is something that I learned through Diabetes Association, is going to be a backbone to a successful lifestyle modification when it comes to exercise. Knowing where your blood sugar is at pre-exercise, midway through exercise, and after exercise is essential. It might take a little bit to kind of see where the changes need to be made as far as insulin and medication, but that's something that you want to talk to your doctor about before starting an exercise program.
Okay. Now, diet, of course, is very important along with the exercise. What can a person do to adjust their diet to help reduce their chances of developing diabetes?
Well, there really is no one-size-fits-all meal plan, but there is.
Well, now that's what I was hoping for, Nicole. You're going to say, here's the answer.
Here's the silver bullet, right?
Hey, Judy, you're doing everything wrong.
But there are certain things that anybody can do to make changes that would improve your chances of reducing the risk for developing diabetes or managing it well. But again, the caveat is make slow changes, introduce them one at a time so that you don't become overwhelmed. But one recommendation would be to make all of the grains that you eat, or 50% of the grains that you eat, at least whole grains.
Okay.
At least 50%. And that means that when we're talking about pasta, we're talking about eating whole grain wheat pasta versus the refined white pasta.
All right.
Whole grain rice versus the refined white rice. And the reason for that is that the whole grains contain more fiber, so it's going to keep you full longer, and it's going to be digested at a slower rate, so you're not going to get a high blood sugar spike that you would with the refined grains.
Okay.
And bread too, of course. Breads, cereals, those are all sources of grains that we incorporate into our diet. So if you can make at least 50% of those grains whole grains, that's a good start. And you only really know that by looking at the labels. It can be tricky when you're looking at a cereal box and you're thinking, oh wow, that looks to be a very healthy choice. And then you turn around the nutrition label and you find out that there's 0 fiber in it.
Read those labels.
Exactly. Or it might contain high amounts of sugar. So reading labels is very important when we're talking about making changes, healthy changes to diet. Another thing that you can do is just look at your dinner plate. Many of us make the mistake of filling our dinner plate with a lot of carbohydrates and fatty proteins. So take a look at your 9-inch dinner plate, divide it in half. Make half of it vegetables. It can be salad, steamed vegetables, whatever your preference is. And then the other half, quarter it. 1/4 should be lean protein, 1/4 should be, again, those whole grains.
Okay.
Try to stay away from saturated fats or trans fats, because again we want to control our risk for cardiovascular disease as well. So those are just a few simple little things that you can do to start making small changes.
And that's important. This is small changes. If you're type 2, you've obviously made poor decisions in the past when it comes to your diet and maybe physical activity. So even just making those small changes are going to make significant improvements. And you've got to be able to kind of stay sane with it. And really cutting yourself off and cutting out everything that you enjoy is not going to lead to successful
No, it isn't.
No, it's not.
Those are good tips. Now, of course, all right, so let's start changing our diet a little bit. Now, how should someone get started with a new exercise routine?
First, talk to your doctor and let them know you're going to be going through with this so you can talk about adjusting medication if necessary. Be prepared. do your research on facilities, really know your schedule. That's the important thing. Everyone wants to come exercise 5 times a week when you first start. You know, it's kind of exciting for some individuals, but you have to be realistic with your schedule and when it can kind of fit in, and you can always make time. There's a lot of excuses, but you can find time for it. At least a half hour a day is usually a good goal. Physical activity. It doesn't even have to necessarily mean going to a gym. If it's walking up and down the stairs, instead of taking elevators, walking around more of the house, doing chores, walking outside, walking the dog, things like that, it's all going to count towards increasing physical activity. So you don't necessarily have to go to a gym and work out there, but that's going to be a good thing to look to.
So a good starting point for someone who hasn't exercised for so many years would be the walking, like you said, walking the dog,
yep.
Walking in the neighborhood around the block a little bit. Start slowly.
That's right.
And then after a while, they're going to see how much better they feel. Then they're going to come see you, Chris.
That's right. And I'm going to tell them.
You're going to work them.
Small things. Always start easy. Go low intensity. Everyone makes the mistake of coming to the gym and really pushing it hard. You know, doing the 3 sets, 12 repetitions right in the beginning. You know, start with 1 set. 10 to 12 repetitions. Get your body used to exercising. Last thing you want is to wake up the next day or even 2 or 3 days later and be extremely sore and really kind of just reverse everything that you've kind of been looking forward to, kind of keep you away from the gym and actually decrease the chances of success towards reaching a goal.
So you're telling me it doesn't have to be that intense?
No,
to
it
be
shouldn't
effective?
be. No, not at all. When you want to burn fat, low intensity cardio for a longer duration is going to be usually what you want to shoot for, but adding strength training with weights is also something that needs to be incorporated as well, 2 to 3 times a week, with 10-15 minutes of a warm-up in the beginning. Do your strength training, a couple exercises, do the entire body. You don't have to do just chest one day, biceps one day. Get a whole entire body workout, low weight, high repetitions, and have fun with it. Find something you like to do.
Yeah,
that's
be work. Important.
Isn't that the key?
That is, yes.
Yeah, that's why I think sometimes the gym atmosphere
can be intimidating
is
for
good
individuals
because
too, though.
there are so many choices.
A lot of choices, yep. You can find some, whether it's swimming, getting in the pool, doing some type of aquatic workouts, great. Obviously, diabetics need to be aware of other issues as like neuropathy, nerve damage. So they always want to get water shoes. Sometimes they lose a feeling in their feet, so protecting your feet is going to be an issue that they want to talk to a doctor about.
How will exercise help a diabetic to lead a more active life?
I think exercise helps everybody lead a more active
so
life.
it's
You
not
feel
just a diabetic.
better.
You just you'll feel better.
Absolutely.
Correct?
Diabetes with type 2 weight loss is really the key there. Just like the whole lifestyle modification. Anybody that kind of makes some type of transformation in their life, whether it's diet or exercise, is going to receive the benefits. Lowering stress, lowering anxiety, lower depression. It's going to release those hormones.
That's right. Yes, and especially with people with type 2 diabetes, there's a high frequency of depression, mental health issues, because it is a 24-hour-a-day disease that you have to cope with. So that can lead to depression. So exercise is an excellent way to release that.
Absolutely. Yep.
Those stresses and improve your mental wellness.
You're right, because that is overwhelming.
It is.
When you're diagnosed, this is a for life thing.
Right.
It is for life.
That's right.
And I know when you exercise, you do have more energy. You do feel better. Your outlook. I know when I'm exercising, just me, I'm not a diabetic, and I feel much better.
Feel better about yourself, absolutely.
And right after I'm done exercising.
Yep.
And I think too, once you get into that routine and it becomes a regular behavior, knowing that you're doing something to prevent those complications from developing that are commonly associated with diabetes, with the heart disease and the neuropathy, as Chris was referring to, that damages the nerve endings in mostly the hands and the feet and causes a lot of pain. Kidney disease. There are a number of complications that exercise will help to delay or prevent.
It's not going to happen overnight either. If it did, and if I could help somebody one night achieve their goals, I wouldn't be sitting here right now. I'd be somewhere else with a lot more money. So patience, really, and understand that it's going to take a good 4 to 6 weeks to really get your body used to going to the gym as often as you are, kind of getting that habit of doing it. And eventually, when you get in that habit, you're just on autopilot. Then you almost, if you don't go to the gym, you kind of feel like you really need to get something.
And I think people have to be aware of with exercise when you first start like we were saying, if you've had a sedentary lifestyle for so long, when you go to the gym and you start working out, you're going to be winded. You don't have that lung capacity, but you will. with time and working, you're going to become more fit. You're going to be able to endure longer periods of exercise, correct?
That's right, but it's working on that endurance over a longer period of time.
Right.
You know, if it's 10 minutes on a cardio equipment, taking a rest, jumping back on for another 10 minutes, then another rest, then maybe another 10 minutes to get your half hour. Doesn't have to be at one time. You don't want to push yourself. The last thing you want to do is injure your body.
And again, how much exercise do you recommend for most people?
30 minutes a day. The general guidelines are 150 minutes a week, try to shoot for. And it's not hard for a lot of individuals, some may, depending on schedule, but it's easily obtainable.
And like you said, even walking is included in that too.
That's right.
That's right.
So it isn't just intense working with a piece of equipment, the elliptical, and
that's right.
which is evil, but that's just my opinion.
And the fact that you can spread it out throughout the day, 10 minutes in the morning,
Exactly.
maybe a 10-minute walk at lunch, a 10-minute walk before bed in the evening.
Is blood sugar ever too high, your level? Is it ever too high to exercise?
Yes, especially for those with type 1 diabetes. If your blood sugar is greater than 250, we encourage the person to test their urine for ketones, which would be an indication that they don't have enough insulin in their body, and their body will continue to break down fats in order to raise blood sugar because it's sensing that the body is starving. So in fact, exercise can increase blood sugar on top of that. So if your blood sugar is greater than 250, you have ketones in your urine, do not exercise.
Now, Chris, what do you recommend if a diabetic comes to you and he wants to do his training with you? Do you have them check their blood sugar level first?
Yep. Ask them about probably the last month or two's history of their blood sugar, their A1C, how often they check their blood sugar, and if they don't do it as often, we start. Keeping a notebook, writing those down, what times you're eating at, when you're taking your insulin before exercise. Obviously when you eat, you're gonna take it. But just being aware of your body and how your body reacts to exercise. It's different for everybody. So really understanding what exercise does what to your sugars is what's going to help you understand your own body and therefore be successful at managing.
Which is great to have someone like Chris on board because every one of us are so different. Our needs are so different. And when you've got somebody working with you, for exercise, you get to know that person one-on-one, what their needs are. Mine are different than Nicole's. So you would know what to for me to work out with that particular day.
That's right.
So that's great. I'm so glad you're on board. This is wonderful. Now, Nicole, where can a person go for more information about diabetes?
They can call the office, the Erie County Diabetes Association, at 454-0715. We also have a website that has a wealth of information related to diabetes and also just maybe stopping in at the office to talk to the nurse.
And where are you located?
We're located on the northwest corner of 12th and State, 1128 State Street.
If someone wants to talk with you, Chris, and get some more information on perhaps an exercise routine, how can they get a hold of you?
Easiest way to contact me, you can always call Lecon Medical Fitness and Wellness Center, ask for Chris, we'll be available, or take a message, I can call back. I'm not really into the whole social media.
But they can call you at Lecon.
They can call me at Lecon, the easiest way, absolutely. Yep, that's the way I would approach it.
I think this is wonderful. It's great to have you on board because, like I said at the beginning, exercise and diabetes are so important. They go hand in hand.
Yes.
You aren't going to be able to control one without the other. I really don't believe diet will help. But boy, you certainly need that exercise.
Yep, it's a commitment.
And what's great to have you here too, Chris, is that there are some of our viewers who, of course, are not diabetic like me, that you may have made us realize we need a little bit more exercise in our lives.
Just a little bit will make a world of a difference. Absolutely.
So this show has been absolutely wonderful. Nicole, thank you so much for coming on the program.
It's my pleasure.
Yeah, it's always a pleasure to have you. Chris, it was so nice to meet you.
You're welcome. Thank you for having me.
Viewers, if you have any questions of Nicole and Chris, feel free to give them a call. Check out the website, Erie County.
It's diabeteserie.org.
Okay, thank you very much. Viewers, until next time, have a wonderful day.